Hello viewers, did you know that 10% of pregnant women experience one form of a mental disorder, primarily peripartum depression? I am Dr. Susan Kuria, a consultant psychiatrist at Mathare National Teaching and Referral Hospital. Today we are going to talk about peripartum depression. Pregnancy is a journey starting with the first trimester, second trimester, third trimester, then we move to the postnatal period, which is immediately after birth up to 6 weeks. There are hormonal changes which occur during pregnancy and up to postnatal period. We can see that during pregnancy, starting from the first trimester onwards to the third trimester, there's the increase of estrogen and progesterone, and these hormones are there to support pregnancy until delivery. Upon delivery, at birth, we can see that there's a sharp drop in these hormones, the progesterone and estrogen. Then there's an increase of the prolactin and oxytocin, which are hormones that they are supposed to support the breastfeeding period. Studies have shown that around this period of birth, where there's this sharp decrease in the hormones that support pregnancy, that it might be associated with the symptoms that patients, mothers experience during the postnatal period. What are the symptoms of postpartum depression? These symptoms are not any different from any other form of depression, mostly called major depressive disorder. The mother will be having persistent sadness or feeling of emptiness or depressed mood. The mother may lack pleasure in activities that previously she was enjoying, as much as we understand that during this period, this mother has to spend most of her time attending to the newborn. Others will be having feelings of hopelessness, helplessness, feeling that they cannot take care of this newborn. Others will be having very low self-esteem. Others will have difficulties in sleeping. It might be reduced, and this might be understandable that the baby might be keeping the mother awake the whole night if she does not really have good support. Other symptoms which are now in the extreme phase of depression is the mother might be having thoughts of harming her baby, called infanticide. And for the mother herself, she may be having thoughts of killing herself. When you notice all these symptoms, kindly seek help. What are the risk factors for developing postpartum depression? In psychiatry, we take an approach of biopsychosocial model, although there's an added component of spiritual. With this, we'll start with biological, then psychological, then social. Are there any screening tools for postpartum depression? Yes, the commonest is Edinburgh Postpartum Depression Scale. This is freely available on the internet and you can administer it by yourself. It has 10 simple questions and the score is 30. Once you are able to review this, kindly seek professional help. Do not go to the chemist to buy medications by yourself. With this score, it helps us to be sure what kind of intervention you need. Not all patients require medications. Some, depending with the severity of the postpartum depression, will only require psychological help. Others may require outpatient services, while others may require inpatient services. There's treatment options for depression with antidepressants. We choose antidepressants which have been proven to be very safe in pregnancy and breastfeeding, so kindly do not be scared. There is treatment out there, and for mothers who already have depression even before getting pregnant, when you are planning to get pregnant, kindly discuss with your psychiatrist so that the psychiatrist can choose the best antidepressant, or any other medication that will be safe for you, your fetus, and your newborn. That is very important. Kindly take note of that. And for us psychiatrists, during postnatal period, we are very careful on which medications we choose for you, so that we can minimize that exposure to the baby who will be breastfeeding. And there are also techniques that we teach breastfeeding mothers who require medication. I'll give you 3 examples. What we do if the mother does not have very severe symptoms, we can give the mother one medication, and we advise the mother to first breastfeed the baby before swallowing the medication. The other option is you can breastfeed the baby before the baby sleeps. So with that, we prefer giving medications at night with the assumption that the baby will be sleeping longest at night, so that there will be minimal exposure through the breast milk to the baby. The other option for mothers who may want to express breast milk at some point and store it for the baby, we advise that when you want to express the breast milk, time when the level of the medication is lowest in your blood system, so that you can express the breast milk and store it for your baby. But that is a conversation with your psychiatrist. Kindly do not do it by yourself. We are here to help you. And for the men who are watching, the potential fathers who are watching, there's also something that you can look at, though it's not a mental disorder, but it's something good for you to check out and reflect if you've ever experienced those symptoms. The beauty of it is that it's self-limiting. It does not require any treatment. It's called covered syndrome. We have maternal child health services, whereby we offer antenatal and postnatal services to our women. All women, whether you have a mental illness or no mental illness. At this point, if you're experiencing any symptoms of postnatal depression, kindly talk to the nurse or the clinician. Then you'll be referred to our psychiatry outpatient services, whereby you'll be attended to by our psychiatrist. For mothers who will require clinician review, we have our psychiatry outpatient services, which offers both outpatient services, and for patients who will require any admission, the doctors, the psychiatrists in our department are going to admit you for further management. We have here our psychotherapy clinic for pregnant mothers who will not require any medications but only psychological management. You are welcome.